Vitamins, Minerals, and Supplements lecture. So it's very important that we include all of the antioxidants, vitamins, minerals, and supplements on a patient's medication list. An antioxidant is a plant substance that protects the body by neutralizing free radicals. Its unstable oxygen molecules can damage cells. Vitamins is defined as an organic substance essential for normal metabolism, growth, and development of the human body. Minerals are inorganic or non-organic, and they are essential for the body for metabolism, growth, and development. Supplements is defined as something added to fill a need or to reinforce the need of something in the body. The best way to include all these is to eat a well-balanced diet. Some indications for supplement are inadequate diet, malabsorption problems. This often happens with patients who have gastric bypass surgery. An increased need for certain nutrients, oftentimes pregnancy needs an increase in folic acid, for example, and deficiency due to medication interactions. An example of this would be our diuretics. They deplete the potassium levels in the body, so we need to supplement that with an oral potassium to refurbish those depleted levels. So there are fat-soluble vitamins, and then there are water-soluble vitamins. Fat-soluble vitamins are stored in the adipose tissue and the liver, except for vitamin K, which is not stored. So our fat-soluble vitamins are vitamin A, D, E, and K. Vitamin A is important for healthy skin and development of bones and teeth. Sources are dairy products, fish, and animal liver, and green and yellow vegetables. Deficiencies show sign of retarded growth, skin lesions, night blindness, and diarrhea. Vitamin A oftentimes will help heal wounds and also fight against infection or sickness. Vitamin D is important for the proper use of calcium and phosphorus in the body. Sources are sunlight. In the northern states in the United States, sometimes we will have to supplement vitamin D because our sunlight exposure is much less in the wintertime. Dairy products, commercial foods that contain supplemental vitamin D, such as our cereals, fish liver oils. Signs of deficiency in children, it would be rickets. In adults, it's osteomalacia, muscle spasms, spontaneous fractures, and osteoporosis. There are two types of vitamin D, two main types I should say. There's vitamin D2 and D3. D3 is more efficient in raising vitamin D serum levels, so patients are encouraged to use the vitamin D form. Patients can be prescribed prescription vitamin D called calcitrol, and the recommended daily dose for vitamin D is 400 international units per day. Vitamin E may promote normal reproduction and helps in the formation of muscles and red blood cells. It also decreases platelet clumping, which can cause bleeding issues with those on anticoagulants. Sources are leafy green vegetables, wheat germ, and margarine. Signs of deficiency are edema or swelling, ataxia, and absence of reflexes. Can also have deficiency in the destruction of red blood cells and muscle weakness. Some off-label uses for vitamin E. Some studies have shown that vitamin E has helped with Alzheimer's disease. Vitamin K is essential in the formation of prothrombin in the liver. It is necessary for forming a blood clot. Sources are dairy products, leafy green vegetables, cauliflower, soybeans, liver, potatoes, and tomatoes. Deficiencies, blood clotting and possible hemorrhage. Patients are often given IV vitamin K as an antidote for warfarin overdose. And usually vitamin K is not effective in the treatment of heparin overdose or the new oral anticoagulants. These anticoagulants have different pathways and are not effective by vitamin K. One of the major signs of overdose in vitamin K in patients is jaundice. Water-soluble vitamins are not stored in the body. They need to be replaced on a daily basis. We have our vitamin B1, 2, 3, 6, 7, 9, and 12. And then vitamin C. All these B vitamins can often be combined into one vitamin B pill called a vitamin B complex. Oftentimes patients will take those. Vitamin C is important for bones, teeth, and small blood vessels. Promotes healing of wounds and formation of collagen. Aids in the absorption of calcium and may help in preventing colds. Sources are citrus fruits and berries, tomatoes and melons, raw vegetables and sweet potatoes. Deficiency signs will include fatigue and irritability, joint pain and bruising and petechiae. Thiamine or vitamin B1 is essential for the release of energy from carbs and nerve conduction. Sources are yeast and wheat germ, lean meats and pork, dried beans and peas, dairy and poultry products, dark green vegetables and whole grain foods. Deficiencies are malaise, numbness and tingling in the extremities and muscle weakness, and anorexia. Deficiencies can often be due to alcoholism or liver problems. Riboflavin, vitamin B2, is important in cellular oxidation and storage of energy. It helps maintain skin and mucus and is necessary for the regulation of certain hormones and red blood cell formation. Sources are organ meats and lean meats, milk and poultry products, and green vegetables, and signs of deficiency include skin and lip lesions, seborrheic dermatitis, and ocular changes such as photophobia and vision loss. Niacin, important in cellular respiration, glycolysis, and lipid synthesis. We often prescribe this for our patients with hyperlipidemia. Sources are liver, lean meats, fish, and poultry, whole grains, enriched flour, and cereal. Deficiencies include dermatitis and skin lesions. Pantothenic acid, or vitamin B5, is important in the metabolism of food. It also helps the work of certain hormones and chemicals in the nervous system. Some sources are whole and enriched green foods, dried beans and peas, legumes, dairy products and eggs, organ and lean meats, also fish, dark green vegetables. The deficiencies of this vitamin are unknown and research is still being conducted. Pyridoxine, or vitamin B6, is necessary for the metabolism of amino acids and fatty acids. Also aids in the production of red blood cells. Sources are muscle meats and liver, whole grain cereals. Deficiency signs are anemia, skin lesions, insomnia, numbness in the extremities. Biotin, or B7, also known as vitamin H, regulates amino acids and fatty acid metabolism. Sources are liver and kidney, egg yolk, yeast and nuts, legumes, and cauliflower. Deficiency signs are dermatitis, anorexia, and muscle pain. Folic acid, also known as B9, important in the synthesis of amino acids, DNA, and red blood cells, important to prevent neural tube defects in the fetus. Sources are liver and yeast and leafy green vegetables. Deficiency signs are fatigue, low red blood cell count, and anemia. Cyanocobalamin, also known as B12, is vital in the production of red blood cells and genetic material, helps in the nervous system function properly. Sources are liver and kidney, milk, muscle meats, and fish. Deficiency signs are numbness, decrease in muscle coordination, anemia, and mental confusion. A lot of times we have patients with vitamin B12 deficiencies. They can take over-the-counter vitamin B12, however, if it has to do with the intrinsic factor in the patient's stomach lining, it will not be well absorbed, so oftentimes we are giving the vitamin B12 injections monthly. Minerals. Mineral acts as a catalyst for many vitamins. There are 5 major minerals in the body that are needed in large amounts, which are calcium, magnesium, phosphorus, potassium, and sodium chloride. There are also many trace minerals in the body that are needed in smaller amounts. This would include iron, zinc, and iodine. Phosphorus is important in bone health, helps metabolize fats, carbs, and proteins. Deficiencies retard the growth, poor teeth and bone development, rickets, pain in the bone, and anorexia. There are no toxicities for phosphorus. Potassium helps maintain the acid-base balance, important in nerve conduction and muscle contraction, specifically our heart muscle contraction. Deficiencies are considered hypokalemia, muscle weakness, mental confusion, and arrhythmias. In cardiology, they are always very concerned about potassium levels due to the arrhythmias that can occur that can be deathly. Toxicity is hyperkalemia, confusion, and coma. Some of the prescriptions that can be written for potassium are called K-DUR, D-U-R, or Chlorcon, K-L-O-R-C-O-N. And you will sometimes see it listed as potassium chloride. Calcium, essential for bone and muscle health, decreases osteoporosis. Deficiencies are hypokalemia, bone deformities and fractures, rickets, and tetany. Toxicity signs are hyperkalemia, constipation, renal stones or failure, and psychosis. One of the common prescriptions that is over the counter that is given for hypokalemia is Tums or calcium carbonate. Magnesium is important in muscle and nerve irritability, helps regulate body temperature, and helps convert blood sugar to energy. Deficiencies are kidney and gallstones, muscle tremors and weakness, mental confusion and depression, and endocrine disorders. Toxicity is respiratory failure, and cardiac disturbances. Sodium chloride maintains the acid-base balance, helps in maintaining heart action, regulating muscle and nerve irritability. Deficiencies are hydronatremia. Oftentimes this is patients who have not drank enough fluids or if they've had severe nausea or vomiting. Loss of weight, weakness, and cramps. Toxicity is hypernatremia, drinking too much water, and then confusion and coma. Other minerals, we have minor minerals, which are iron, important in hemoglobin formation, Oftentimes, iron will be prescribed to patients who have lost a lot of blood after a major surgery. Some of the prescriptions that can be prescribed for iron are called Phi-Sol, Slow-Fi, or Ferritabs. We can also give Femeron as an IV iron supplement if hemoglobin levels are at a severely low level. You will also see this medication on the list as ferrous sulfate. Iodine is important in thyroid health. Oftentimes we do not have to supplement this in developed countries such as the United States because all of our salt, our table salt, is ionized. The only time we have to worry about this is in third world countries. Zinc is important in wound healing. Fluoride helps prevent dental cavities and osteoporosis. Oftentimes children that are raised in rural areas that have well water, we will have to give supplemental fluoride to prevent dental cavities. Other common supplements, and this is just a small list of the very, very common that we see a lot on medication lists. There are several others in your book, and there are several others that are not even mentioned in your book. So the most common are aloe vera for sunburns and eczema, garlic for diabetes, allergies, and thyroid disease, ginger for alopecia, cold, irritable bowel syndrome, motion sickness, and nausea. Ginseng is for allergies, cold, flu, enlarged spleen, memory loss, and stress. Lavender is for hay fever, insomnia, and stress. And cranberry is for UTIs and bladder infections. Some more common supplements are fish oil and red yeast rice for cholesterol, Ocuvite for eye health, melatonin to improve sleep, St. John's wort to reduce anxiety and depression, saw palmetto is for BPH and used as a diuretic, and then glucosamine is an anti-inflammatory and for arthritis. Oftentimes, doctors will even prescribe, especially the first three, the fish oil, red yeast rice, Ocuvite, and then also glucosamine. Those are very common vitamins for even doctors to mention for them to take. A lot of times patients will take these supplements and they will take a lot of them. You will find that patients either believe in supplements such as these or they don't, so either they will have a lot of them or they won't have any, is typically what we see in the clinic. These are not very well regulated by the FDA. The only time that the FDA really regulates them is if there is a safety concern or there are many people getting sick from those types of supplements.